Chapter 16, Nutritional Aspects of Pregnancy and Breastfeeding, Screencast 2. This screencast will be focusing on the change in energy needs that occur during pregnancy. Think about the increased metabolic demand that is required by pregnancy. So it should not be a surprise that additional calories are going to be necessary to fuel the supportive growth of both maternal and fetal tissue. And once again, think about all of the extra metabolic work that is now being done. Now, if we look at the caloric requirements during the first trimester, there really doesn't need to be much of a change. Moving into the second trimester, the woman should be eating an additional 350 kcals per day. And going into the third trimester, this should increase on average to about 450 kcals per day. So this is in addition to normal energy input. Now, if the woman is overweight or obese, these increases can be smaller. And if it happens to be a teen or underweight or active individual, then they're going to have to increase the energy input correspondingly. Now, if we look at infants that are born to women who do not consume enough calories during pregnancy, there are a number of significant outcomes that are related to this. The infant may be born small. The infant may actually die soon after birth. One thing that may happen is the infant may develop what's called a thrifty metabolism later in life. And what this means that eventually they're going to be more efficient and try to expend less calories. And the emphasis will actually be on storage. This can increase the likelihood of developing into obesity or type 2 diabetes. There's a greater risk for future development of heart disease, high cholesterol, and high blood pressure, and also an impaired immune function. Now, if we look at specifically the nutrients that are needed to increase, it shouldn't be a surprise that protein needs to increase significantly. So protein increased by 50%. If we look at essential fatty acids, specifically omega-3 fatty acids, these are going to be necessary for development of brain and eyes. As usual, you should try to minimize trans fats. Zinc is really important. Deficiency may result in birth defects, retardation of fetal growth, premature birth, or spontaneous abortion. Now, folate is probably something that you've heard of, especially with regards to deficiency. But we also kind of have to look at vitamin B12 in addition with those two. Both folate and B12 are especially necessary for the synthesis of DNA in cells. If there is a deficiency of either folate or vitamin B12, this may result in premature birth, low birth weight, retardation of fetal growth, spontaneous abortion, poor development of the placenta, or neural tube defects. You've probably heard of spina bifida associated with a folate deficiency. And really what this is kind of impacting the development of the neural tube, which will eventually develop into the brain and spinal cord. And we can kind of see that in that diagram over here. So normal development is being shown. Now, iron, we all know iron is especially important for the transport of oxygen. So there's definitely going to be an increased need of iron to meet the demand of maternal red blood cells and fetal accumulation of iron stores. The absorption of maternal absorption of iron may increase up to 3 times. It is recommended that women that are pregnant take a supplement, about 30 milligrams per day. Now, this may have some other side effects. It may cause a decreased appetite, nausea, vomiting, and also the potential for decreasing the absorption of zinc and copper. Now, a deficiency in iron may actually result in low birth weight, premature birth, or infant death. Now, if we look at the development of the skeleton, so primarily bone and teeth, there's going to be an especially high need for vitamin D, calcium, phosphorus, magnesium, and fluoride. Now, the mother will absorb calcium more efficiently. Now, it also may come from bone. A deficiency in vitamin D can lead to osteomalacia in the mother or rickets in the developing fetus. Now, one thing to keep in mind here, women that are pregnant do not have an instinctive drive to consume more nutrients. Now, you've heard of many women reporting cravings during pregnancy, and some of you may have actually experienced these cravings if you've been pregnant yourselves. Now, some are especially unusual. For example, some women have expressed a desire to eat really, really weird things, clay, rubber bands, and this is actually known as a disorder called pica. Now, it is recommended to eat small amounts of desired food along with regular meals or snacks in an effort to avoid malnutrition. Now, another thing that might happen when a woman is pregnant are aversions to certain odors and flavors. So all of a sudden, these could have been things that were well tolerated prior to the pregnancy, but during pregnancy, these actually result in a very noxious stimuli.